And we get our visit from my good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. And Joe, good morning. What do you have for us today?
Hey, Ray. Good to talk to you today. One of the great mysteries of the football season in Cleveland fandom right now is what's the deal with what's going on with Greedy Williams. People barely remember him now. He's in the witness protection program. Nobody has seen him for weeks, and everybody thought that he was going to be back a few weeks ago. And when the injury occurred in camp, there was even some talk that he wouldn't be out that long. And, every week it seemed people were given a Greedy update. And then once he went on the IR about mid-season, now people have kind of forgotten about him. So, it's a little bit strange is sometimes with certain injuries, they're very protective with any information they give. A lot of other times they'll say, hey, it's a shoulder injury and, separated shoulder, will be back in 6 weeks, a dislocated shoulder, and here's what they're going to do. But in this case, they just kept saying shoulder, and that's it. And as time went on, about 4 weeks ago, he started practicing again. And they actually were talking about whether he might even be on the active roster. And then pulled him back from the active roster. He got on the injured reserve list, which means he's going to be out a while, 3 or 4 more weeks. We're coming up on that now. But then they threw out one more word, just in one sentence that I read, they mentioned it was a nerve injury. And there's a couple of nerve injuries that cause shoulder pain and shoulder problems that are really hard to understand, but they're pretty common in football, wrestling, hockey, rugby, collision sports. One of the injuries that's a nerve injury that's very common and that I'm suspicious of with all this talk with him is a thing called a stinger or a burner. Our fancy word for it is a brachial plexopathy. And that group of nerves, there's actually 7 of them that go from the neck down the arm. They innervate. They bring sensation and they bring strength to different muscles through the arm. And what happens to them when you're going to tackle somebody or you're hitting somebody and you stretch those nerves very badly or you stretch them multiple times over and over again, the nerve gets injured. And the nerve can be just stretched and irritated, and people get back to play very frequently, or it can actually be damaged. And in the sport of football, very much the same in high school football. We deal with it every week. We saw one on the field last week. Is much of the time these can be transient or real short term initially. They can last just for seconds, and they have a dead arm, and you'll see the athlete kind of holding the arm at their side, and they have no strength. We obviously don't let them back in a game if they have no strength. But many times, 3 minutes, 5 minutes later, we'll be checking them on the sidelines, and the strength comes back. The nerve was just stretched. But what happens if that happens over and over again, or a more significant injury to the nerve? This can last for a week, 3 weeks, 6 weeks, 8 weeks, and without strength, they just can't play the sport of football or any of the other collision sports I mentioned earlier. And so they'll be out for a period of time. You really don't know until they get back to play. So one of the real mistakes is people say, well, we need to get an MRI. That'll tell us. MRI tells everything, doesn't it? Well, an MRI doesn't tell anything about a burner or a stinger. There is a test called a nerve conduction test that tells how much damage to the nerve, but it really isn't very good till about a month. In the first month, it's very can be overread quite a bit, and not very helpful to us. So that test becomes more helpful at about 1 month's time. And so nerve injuries can cause pain and weakness in the shoulder. Another one that can do it can be a disc in the neck. But if he had a disc, they might be talking surgery now. They might have been saying something sooner if that had shown up on an MRI. And I suspect there's a chance that as we are dealing with many high school kids who have this injury right now, the guy that's in the witness protection program for the Browns, who we haven't seen for a while, might be a bad stinger or burner or injury to that bundle of nerves coming out of the neck.
Well, you're exactly right, though. We haven't seen Greedy in some time. Dr. Joe Congini with us, Akron Children's Hospital, Sports Medicine Center. Joe, I had one question for you today.
Yeah.
Because this football season is strange, of course, with COVID-19, shortened
Sure
season, teams putting their games together in a hurry. Have you seen more injuries than you normally do in this fall with football?
Well, I pontificate about that in my office quite a bit. I guess at this stage of my career, I'm allowed to do that. I was really curious to see whether the COVID break was going to actually be helpful because for the first time, a lot of our athletes who never take a break were forced to take almost 3 months off totally and then get back. And maybe with some of the overuse injuries and other things, the resting it would be better. Or would they get out of shape, lose some of their conditioning, and then to rush back on the field in June and July and playing in August and things like that? I truly believe, to answer your question, there are more injuries this year. And I truly believe that big stoppage of doing anything did have a lot more people going to camps not in very good shape, not in the type of shape they'd normally be in. And I think that this year we're seeing at our office really an increase of a lot of those injuries that are related to deconditioning, we call it, or kids not being in good shape.
All right, Joe. Great stuff this morning, my friend. Thank you for the time. You know, I always appreciate you spending some minutes with us on Wednesdays, and we'll catch up with you again next week.
Thanks, Ray. Enjoy the rest of the week.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, gives us insight into sports medicine each and every Wednesday.